What day is it?
It's the 9th.
Is it actually?
I think so.
Yeah, it is. Okay, so it's the 9th of May, which means that my top surgery with Dr. McLean was a week ago today. Things are going well. Anything to say?
We're staying in a snazzy condo.
Snazzy condo.
We can give a tour later.
Yeah. Overall, healing has been really good. I have had very little pain at all. I have a little bit of T-Rex arms, but not at all what I was expecting to have. Yeah, I'm pretty doing alright. I was only on T3s for 2 days.
2 days, 3 days, yeah, 2.
So that was good. They said that I took really well to the anesthetic. It's not a big deal. And yeah, I had Dr. Baker, who's Dr. McLean's main anesthesiologist. He was really great. The worst thing that happened this entire trip is that I caught a cold on the plane coming from Vancouver, and so it was a little bit scary because I had a cough and a fever right up to the day that they were doing surgery, and they told me to go on these antibiotics, and then I didn't actually go on them because I didn't think it was necessary because it wasn't bacterial, so I didn't do it.
It's fine.
Yeah, I'm really glad that I didn't go on it because I didn't need it at all. There was no problems, and I felt a bit awkward saying that I had gone on them because people kept asking me and making sure that I was taking them, and I was like, yep, everything's fine. But everything was fine, and my cough is totally gone now, which is good. And they were worried that it was going to settle into my lungs, and they warned me make sure that you keep coughing. And so even post-op, and it actually wasn't that painful.
You're doing really well.
Yeah, I don't know. It was a little bit painful.
It's basically gone now.
Yeah. And the worst thing that happened out of the whole thing is that I got really constipated, which I was expecting to happen, so I was actively doing things about it. And so right when I got home after surgery, or here after surgery, I took, I don't know, we'd gotten some sort of laxative, and then that wasn't doing anything, and so, what was it? It was night 3.
Where I wasn't there.
Yeah, Mark wasn't there, but my sister was here with us for the first, week-ish. And so by night 3, nothing was moving still, and so, my sister kept on making me drink this really gross, tummy tea, and then I took, 2 tabs of X-Lax, and then I had, the worst night of my life, because I just had, horrible stomach cramp pain, and it was really bad, and if you can, get that dealt with and moving faster than I did, do so, because it was awful. And then
I'm glad I missed it.
Yeah, I was up most of the night, and then I threw up, and then I felt better. But my sister was there, so it was fine. But
nobody
actually
told me till I got back.
Yeah, it was okay. Because she was there to hold the bucket really high, it didn't hurt because I wasn't actually exerting anything on my chest. And yeah, so that's been the worst of it, really. And also that was because I was just by that point, I was totally full of drugs, the T3s.
We have a mini pharmacy on the shelf over there.
Yeah, especially because of my cold, which is good.
And then tomorrow we're going back to Dr. McLean.
Mm-hmm. Tomorrow we go back to Dr. McLean to get my grafts dealt with. So, that'll be good. He's been really great. He's very giving with his time and, like, really wants to answer all of your questions. And, like, I don't know. Some people have, like, some complaints about him about, like,
being too touchy without the consenty part.
Yeah, just, like, not really asking for your consent. Because, like, I don't know, he's a surgeon, and so he's, like, used to just kind of touching people, and it's not, like, a big deal for him. But, like, we've noticed that he's definitely, like, I guess people have kind of been making him more aware of this, and he's been, like, actively trying to work on it, and so that's good.
I had a free consultation a few days ago where he went to, fondle my chesticle area, and sort of froze halfway there, realized what he was doing, and then asked if it was okay after pulling away, and then resuming.
Yeah, so that was good. So yeah, I've already been having, like, a lot of, like, weird nerve pain and stuff, especially, like, in my nipples keep, like, vibrating, which is weird. But, good compared to the alternative, and so, yeah, very little pain unless I'm, like, moving too quickly or, like, lifting too much, or if I'm, like, pushing on anything, because there's a little bit of bruising, but not much. So I guess probably just, like, show it. Buttons.
You want me to take it off?
Well, I have to take the buttons.
No, I know, but
Yeah. Otherwise, there's no point. There's nothing to see. This button doesn't hold on to the... Oh, it's fine. It's because the fabric has, like, separated.
This is the part where Dallas gets naked, but not really. Only half. Half naked. Alright, so we have these, like, super fancy strappy things that actually don't really do very much except for fall down sometimes.
They really do nothing.
You got it?
Yep.
Alright. Let's take this thingy off. I have to find the back. Ready?
Yeah. Normally they have them done up in, like, the front, if you watch people who've gone to McLean, but we found it significantly easier to put it on doing up in the back, and it does the same thing, so. And yeah, so far, like, no real complications. There haven't been any, like, seromas or anything. So that's good. That's what it looks like. Do you want to, like, bring the camera closer? Ah. So yeah, you can see there's, like, bruising here and there and a little bit up here, and, like, I don't know, this side is, like, swollen more than the other.
One thing too to take note of, some of the purple there is pen.
Yeah, a lot of it's pen.
There's a lot of purple pen.
All of this is pen, and most of the purple around the nipples, besides, like, this little bit, is pen. And from what I can tell, I can basically feel almost everything. Like, there's a few spots that are, like, a little bit numb, but mostly I can feel it. And, like, I can't feel the nipples, really. But it's weird, because, like, they have sponges on them, so we'll see. So yeah. I've been getting really itchy, too. Like, my actual, like, skin and everything. Partly from the binder, and partly, I think, just from, like, sensation coming back. But yeah, I'm super duper happy with it so far.
Let me put it back.
Yeah, sure. There's, like, there's very, very small amounts of, like, ripples from what we can see. Like, I have some stretch marks, so that's mostly what that is. There isn't actually any, like, skin.
Some of that, too, is from, like, the gauze has,
Like the tape.
like, yeah, the gauze and the tape and stuff have ripples, and so we don't really know at this point how much of it is from just, like, impressions on the skin and how much is actually the skin.
But I feel really good about it. There's, like, no dog ears from what we can see so far, which is good.
Yeah, it's really good.
But yeah, feeling good. And we'll take another video once.
Tomorrow.
Yeah, probably. Once the nipples are off. I don't know, like, Other thing that kind of sucks is not being able to shower. I took a couple of baths, but it's kind of hard to like get in and out, especially because the bathtubs.
We'll show you during our tour.
Yeah, they're like really deep. But yeah, so far everything's really great.
Everything's really good.
Yeah.
And the staff at the clinic are really good.
We love Liz.
Yes. If you have a chance, Liz is pretty excellent.
Yeah.
Shout outs to Liz.
Shout outs to Liz. So yeah, that's pretty much it.
Yeah.
We will make another video soon.
Yes.